Hey guys, how you doing? Have any comment?
We met today for conversation. We had a good conversation, and we'll have conversations in the future. Thank you very much.
Thank you. Did you get that, Annabelle?
I got it, yeah.
Yeah, watch it now, the camera's on. Hey. Hello, guys.
Hey, gentlemen, how you doing?
How you doing? Who you with?
I'm with Channel 9.
Channel 9. Okay.
How you doing, sir?
Just fine, just fine.
Hey, Mayor, how you doing?
We're here today talking about some very serious matters. I want to read something out of this very powerful book about healthcare, because the whole issue of providing rural healthcare has a long history in North Carolina. Actually, the program on access to healthcare was the brainchild of William Henderson, retiring director of the North Carolina Medical Care Commission. The commission, in addition to its other responsibility, was responsible for funding under the Hill-Burton Act to bring small hospitals into small towns in rural North Carolina. The fact of the matter is that what they saw then was that many people didn't have access to emergency care, and that there needed to be in North Carolina a commitment to that. The hospital is a familiar landmark to most North Carolinians, and it was a logical place to provide 24-hour care. Perhaps the emergency rooms are the most democratic places for the practice of medicine in America, the most democratic places. So we've been today engaged in some mediation with the Office of Civil Rights in Vidant. We've had some very serious, open conversation that we're glad about today. We're going to begin some more conversations next week. We are under an obligation, because we're in mediation. We can't talk about what was discussed in the mediation. But since this morning, about 10 o'clock, we have really been having dialogue in a very deliberate way regarding this issue of the future, the hopes and the dreams of the Hyde County community, the Beaufort County, and particularly Pungo Hospital. We are still quite hopeful about these conversations and where they may lead. And at this time, to make our commitment to this mediation, we cannot discuss those matters. Simply say to the public, we've had these very serious conversations, and we will have even more on next week.
Can you at least say if you think it'll be resolved by the April 1st deadline that we've been talking about?
Well, we wouldn't be in mediation if we did not believe in the possibility. We believe that we always have the possibility of a vision that moves us from division to unity, and a vision of doing what has been the focus of North Carolina for a long time, and that is to ensure that people of all races, colors, creed, and kind in rural communities have access to health care and access to emergency room services. That is a hope not just of the NAACP, or not just a hope of the mayor, not just a hope of the people in this room, but that has been a hope for North Carolina. And we intend to continue fostering that hope. If we did not believe that, we would not be here engaged in this mediation. You know, with OCR, there are other avenues, but right now, the avenue we're focused on is this kind of mediation through conversation that we believe can result in some very concrete decisions. But I'm not at liberty to discuss anything further than that was discussed today.
No, I think we ought to just cut it right there.
Okay. Thank you guys. Really appreciate it.